Hey community, we're back and I'm Brandy B, the Community NP.
And I'm Brandy G, the Community NP.
And together we are
B&B The Community NPs.
What are we talking about today, Brandy?
Sexual dysfunction in men.
Yes.
Okay.
So we'll primarily focus on erectile dysfunctions, but there's several different types of dysfunctions that we're gonna tell you about.
Okay.
So go ahead.
You want me to get started?
Yeah.
All right, I'll get started. So the first type of sexual dysfunction we're going to talk about is erectile dysfunction. So it's an inability to acquire or maintain an erection for sexual intercourse.
Yes.
So basically the man can't get an erection.
Yeah.
So that's erectile dysfunction. So then there's decreased libido.
Yes.
That's the lack of sexual interest. You don't have the urge to have sex. So that's decreased libido. Then there's premature ejaculation that occurs too soon before a man is really ready to ejaculate.
Yes.
And then there's delayed or inhibited ejaculation. So it's difficulty getting an ejaculation. Maybe they can't get it, or they're really trying, they really can't get it. So that's delayed or inhibited ejaculation.
I think a lot of that probably is psychological.
I know.
Like they're just too focused on it.
Yeah.
And then they just can't climax.
So just relax.
Just relax.
Just relax.
And enjoy the ride.
Oh, no pun intended.
Yeah, none.
All right, then there's Peyronie's disease. So it's a curvature in the penis that is caused by either trauma during sex.
Yes.
So Peyronie's disease. So
But
that's
other
the
things
different
can
types.
cause it too, right?
Yeah, other things can cause it.
But yeah.
Yes. All right, so let's tell them about some facts, Brandy.
So erectile dysfunction is pretty common. It affects about 10% of men per decade. So like, for example, if you're in the age group of men in their 50s, then 50% of men have ED. So like 40% of people in their 40s.
All right, so if you're in the age of 20, so 20% have it.
Yeah,
Okay.
but that's low.
What
right?
about the age of 10?
I don't even want to think about the kids. But it affects 30 million men in the United States.
Okay, that's a lot.
That is a lot.
Okay.
And premature ejaculation, that is more common in like people in their 20s.
Okay. So let's talk about some of the causes of erectile dysfunction.
Okay.
All right. So we know one of the causes is lack of blood flow to the penis.
Yes.
So cigarette smoking can cause it. Alcohol, overconsumption of alcohol can cause it. Diabetes, high blood pressure, being obese, even as you age. Because I see this a lot in my older males.
Yeah.
That
Who
they-
are very still much interested in having sex.
I
So
know.
it is a problem.
Yeah, so they want to be treated
Yes.
for it. Okay.
So, and then there's neurological causes like stroke, diabetes, spinal cord injuries, prostate surgery, anything that causes damage to like the nerves.
Okay. So sometimes medications can cause it. Blood pressure medicine, that's probably one of the common ones. Antidepressants, opioids, having a low T level, testosterone level can also cause erectile dysfunction.
So we say some of the blood pressure medicines can cause erectile dysfunction, but also having high blood pressure causes erectile dysfunction. So don't just stop taking your medications because you feel like it's causing the ED, because it could be just having high blood pressure.
And isn't like the beta blockers? I know that's the one that I have a lot of problems with is beta blockers. When my patients are on beta blockers like metoprolol, they want to stop it.
Yeah,
they want to stop taking
I noticed that in calcium channel blocking.
the amlodipine.
Yeah,
Okay.
But yeah, also psychological issues like depression, anxiety, inability to focus. So that can cause erectile dysfunction too.
Okay.
So sometimes it just takes treating the underlying cause to fix the problem.
Yes.
Yeah.
Okay. So a lot of times, the patients don't want you to treat the underlying cause. They just want the problem fixed. They want you to give them a pill.
Yes.
They didn't want the problem fixed. But I try to explain to them, like, it can be, I don't want you to have a heart attack or stroke because you want to have sex.
Yes.
So,
It's
one
dangerous.
patient told me, that's my prerogative. I'm like, no, not on my watch.
Right.
Not on my watch. So it is a serious condition, and it's a condition that men want, they want to be treated for it.
Yes, for sure, which is understandable.
Yes.
But how's it diagnosed?
Sexual history, physical exam, and blood work.
Yeah.
Yep.
So in the blood work, we're usually testing for your testosterone level.
You want to check the prostate also.
Prostate
Yes,
levels, yes.
Okay, so how can we treat this, Brandy?
Weight loss.
Always weight loss.
Yes.
Weight loss is the cure for almost everything.
Yeah, and what else?
just want to stop smoking. If you're drinking alcohol, you want to cut back or stop drinking alcohol.
Which is also the cure for everything. And then, so you may have to get your medications adjusted. Yeah. Like we said, treat the depression. And of course, there are medications like Viagra, Cialis, but I personally don't prescribe them if somebody's like, they have cardiac disease, or it's not controlled. Like they have high blood pressure and it's not controlled.
Yeah, if they're on any type of medicine for chest pain, for chronic chest pain, angina,
yeah, it's too risky.
Yeah,
and I get it. Like I feel bad because I know how important sex is, but I just can't.
I send them to a urologist.
Yeah,
so the urologist can do a further examination and see if there's some other underlying cause, and go from there.
Yeah, because like we said before, the most important thing is treating the underlying cause.
Yes.
So, yeah.
All right.
Oh, and also the other thing was I wanted to say, be cautious about buying those over-the-counter supplements like that they advertise on TV. For one, they're not FDA approved. Two, we don't know like how reliable they are or how even safe they are. So you got to be safe with that.
Because when I'm always driving in the car, I can hear the commercial about it's free. Call this 1-800 number. You can get it for free. I'm like, okay, it's free, but we know that Cialis and Viagra they cost a lot per pill. Like y'all got free medicine y'all sending. So be cautious about that.
Yeah.
Okay. So some other treatments are suppositories that can be placed inside the penis. There's a vacuum-assisted erection device.
Yes.
There's a penile prosthesis, like a penile pump, which is surgically implanted. Revascularization, so that's if the blood flow, something's going on, they can revascularize, make that blood flow to the penis. Testosterone replacement therapy. That's the T-cell clinics?
The T clinics.
The T clinics, okay. And treating, if you have psychological problems, anxiety, depression, treating that. That can something going on. So treating that.
Yes.
All right, B. So we done talked about erectile dysfunction and dysfunction, sexual health dysfunction in men.
So if you guys have questions or anything, you can always reach out to us.
Yes.
But go ahead and give them our disclosure.
All right. So you guys know, as always, this information is solely educational information for you and your family members. Wives, girlfriends, please share with your loved one.
Yes.
It's not to replace your primary care provider, period. We still want you to see your primary care provider at least once a year minimum.
Yes.
Okay?
Come see us.
Yes.
Or whoever you see.
Yes. You should come see us too if you want to.
Yeah.
Yes, just DM us. We'll tell you where we at. All right.
But yeah, so that's it.
What can they do, B? You want them to follow us?
Follow, like, share, subscribe.
Yes.
So follow, like, share, subscribe.
Share, subscribe. Okay.
Yeah.
All right.
YouTube, Instagram, Facebook. We're all over social media and out in the community. So, but anyways.
We're B&B The Community NPs, okay?
Yes. And why do we do this?
Because community is our beauty.